Welcome. I'm Miriam Gilmore from STL Partners, and thank you for joining us today for our webinar on digital health, where we'll be looking at where the biggest opportunity is for operators in digital health. So I'll just run us through a couple bits of housekeeping before we get started. You should be able to see a control panel on the right-hand side, which you can expand or hide using the orange button at the top, which is labeled as arrow 1. And there's also a questions box in the control panel. So do please type any questions or comments that you have there, and we'll go through these at the end in our question and answer discussion. And we'll only be using first names, so don't worry about anonymity. People won't know who's asked what. All attendees are muted, so if you're facing any issues, do please notify us in the chat box, and you can also raise your hand to get our attention using the little hand button that I think is labeled with arrow 2. If you do have any problems with sound, then please try adjusting your volume settings locally, and if that doesn't work, try signing out and signing back in. But if we do have a lot of people reporting sound issues, then we will try and address that here and see what we can do to fix that for you. Final point is that we will be sharing a recording and the slides from today's session out after the event, and we do encourage you to share those with your colleagues. And we'll also be sharing a copy of the question and answer. So all of the responses that we talk through in the session later, and any responses or any questions that we don't have time to get around to today, we will be sharing those with you in a written form afterwards. So I'll move on now to introducing our speakers. We have myself, Miriam Gilmore. I'm a consultant at STL Partners, and I'll be moderating the discussion at the end of the session. We also have Amy Cameron, who works on the research team at STL. She's a senior analyst and is the research lead of our digital health practice. And then finally, we have Darius Singh with us, who's a senior consultant at STL, and he is the digital health practice lead at STL Partners. And Amy and Darius will be presenting for us today. So without further ado, I'll hand over to Darius.
I actually think this first section is Amy, so I'll hand back over the reins.
Hey everybody, thank you so much for joining us today, and it's really exciting to be sharing some of the initial findings of some financial modeling and some ongoing research that we're doing in the digital health market at STL Partners. So our starting point is these 5 application areas that we've targeted as the most interesting one for telecoms operators. Obviously, digital health is a massive market. There are lots of different angles of it. There's, a whole element of pharmaceuticals and, lots of other stuff that we don't cover in depth in our research. And that's because, having looked at this market for 2 or 3 years now, we've tried to narrow down the spaces where we think there's the best opportunity for telecoms operators. So before we dive into the meat, just a quick overview of what these 5 application areas are. So the first one you have here on the left is personal health and wellness, and that's really a global market, where you're seeing players like Apple or Google or health management apps playing at a global level and reaching the consumer market. And so in the definition that we use, this is really outside of the formal healthcare provision. Next up, you have diagnostics and triage. And this is really, what happens before the patient encounters their healthcare provider. So they may be calling in for some services. In the UK, we have a phone line called 111, and similar things exist in other countries, or there may be online services. But increasingly, we're also seeing a lot of AI-enabled triage and diagnostics occurring. And actually, diagnostics is also happening during care. Once you've been assessed, there may be applications of AI also to help make a faster diagnosis or get through some data more quickly about patients. So we'll dive into more detail on that later. Next one is virtual care and telehealth. And that's obviously been in the news a lot through COVID. While none of us have been going into the doctor's office, we've been doing all of our consultations on the phone. But other things that fit in that bucket are things like online appointment booking facilities, prescription management on online tools, and then maybe some of the further out things like connected ambulance might fit into this bucket. The fourth bucket is remote monitoring. And there are a number of different things that we're seeing here. So there are some things that are purely application based, where you're having, particularly in the US, some of the biggest companies are ones that are applications that are helping people to change their behaviors in order to control chronic diseases or to manage diseases like diabetes or hypertension over the long term. But other things that also fall in this bucket are ones that are, using actual sensors. So it might be assisted living for people who are vulnerable at home or in care homes, or it might be using sensors to monitor patients post-surgery, both in the hospital and at home. The last one is data and analytics. And to be honest, data and analytics are embedded in everything. Obviously, the more data you have, the more you can apply analytics. But we've separated it out because there are some areas that are a little bit different than others. So for example, when you're thinking about population level health analytics, or you're thinking about the potential impact that universal patient records could have in supporting population level health analytics, that's kind of what we're thinking about this data analytics bucket. But anyway, we'll go into these in more detail because they do map against the financial modeling that we'll be sharing with you guys. So I appreciate that this is quite a small page, but it's just a taster of something that we've been starting to do in STL Partners, in which we will be publishing coming in the new year. But we're trying to, begin to track the interesting companies that telecoms operators may identify as partners in the digital health landscape. And we've sort of benchmarked them against our 5 application areas. And I think, a high level look at some of this, this is a combination of some well-established players as well as some up and coming players in some of these application areas. What you can see, obviously, in the dark blue, where we have the buckets labeled M, that's the main function of the application. And then where you have the light blue with the P, that's a peripheral function. So 2 things to take away here. One, that virtual care and remote monitoring are both kind of heavy duty buckets where you see lots of people playing. But secondly, is that as the digital health market matures, and as these companies mature in their offerings to the market, they're starting to expand horizontally, right? So these aren't mutually exclusive all the time, right? If a company is starting in virtual care and telehealth, and a great example who we did a previous webinar with is Babylon Health in the UK, and they provide a virtual GP service, and they have expanded into the triage area to the left, right? So they're doing some self-care and AI-enabled triage for patients before they meet the GP, so they can investigate what their issue may be. But it's not just with patients that they're doing that. They're also offering it as a service to hospitals in order to enable hospitals to run their triage more effectively. And another example that we've seen is, for instance, Teledoc, which is a big provider of virtual care platform in the US, has acquired Livongo, which is a remote patient monitoring solution. So they're kind of moving in another direction as they mature. The other thing to take away from this, and I think which will be important when we think about really what the opportunity is for telcos and how they can help navigate their local healthcare markets, is that you can see a lot of the time the end user and the payer are different. So if you're, there are a few here where you can see that the payer is the consumer, they're paying out of pocket, and they're also the end user. That's, a really relatively straightforward business model. But if you need to provide the service to a healthcare organization, and it's a hospital that's buying it, it's a clinician that's using it, it's a patient who's the end user, the system gets a lot more complex and it's a lot more difficult to implement, and that's where you require more coordination. So those are just a couple of high-level takeaways and a snapshot of something that we're going to be building and building on over the coming months, and thinking about, what are the potential opportunities for telcos to partner with these different companies in these different application areas. So that's just the start of the question. I think I'm going to hand over to Darius now to think about it from another angle.
Yeah, no, thanks a lot, Amy. So as you mentioned, different application providers are thinking about the opportunity in different ways, and they might land in virtual care and telehealth as Babylon did, but then move into diagnostics and triage. And so they're thinking about which application area do they want to play in, and where should they evolve. And realistically, telcos should be thinking about the same. So as well as thinking about, who are interesting players to partner with now, you should be thinking about, where do I want to go, and how can my partnership ecosystem help me deliver that. So you need to think, yourselves, is remote monitoring the biggest opportunity for me? Is diagnostics and triage really where I should be focusing? But on top of that, what you really need to consider is, where in the value chain do you then play? So while application providers are thinking, how do I move horizontally? Telcos, we think, and what we've written about quite a lot, is we need to think, how do I play more vertically? How do I move beyond just connectivity, and in the coordination age, move further up to play a higher value role? So things like, reselling the application, providing a level of professional services, whether that's ongoing managed services, playing more of a role that Telus has played in the application and enablement by creating these kind of orchestration and data management platforms. So telcos really need to consider not only which application area do you want to start in, but then your ambition within that application area to maybe move beyond connectivity. And what we've done is try to think, well, there's a couple of different models that telcos could use to actually play in those spaces, and depending on where in this spectrum and this map you want to fit, there's a couple of different ways to do that. So in the yellow here is where we think the telco could sell that capability directly to the consumer as a telco branded capability. The blue is where the telco may still be selling to the consumer, but is actually just reselling a partner's capability. So it's still them fronting the solution, but it's actually developed and owned by a partner. And the third in the red is where the partner would provide that directly to the customer. And of course, in network connectivity, that's primarily a telco capability, but there's others where we think the telco could be developing their own capabilities and selling those as part of the solution. In infrastructure, it could be in edge or private 5G. In data management, as I mentioned, Telehealth have their kind of platform and exchange, and they develop that themselves. And that's an area where a telco capability clearly has a strong right to play. But you could also, healthcare is a very local market. You could be using your field force and the scale of the telco to deliver your own systems integration services or ongoing managed services. So we see those as potential areas where the telco could have a direct impact. But as you can see in the light blue, we really do think telcos could be moving up the value chain by leveraging partner capabilities, and especially in healthcare, as I mentioned, such a local market, heavily regulated, a lot of data privacy. The telco, as a local player, has a strong right to do more, and to partner with application providers to provide that app, to provide the end device. And we do see telcos taking that step and moving into that area. Not necessarily developing themselves. That's a big step to take. Not a natural playing field for telcos, but being able to leverage a partner effectively to actually move further up the stack. So the key takeaway here, not just defining, yes, I want to go through remote monitoring, but defining where in the value chain you want to play. And this next slide is saying, okay, well, you may have defined the application area, and you may have defined where on that map you want to play in terms of the value chain. But we wanted to dive into a little bit about the partnership landscape and how that model could work. And as well as thinking about where on that map you want to play, you need to think about the end customer as well, and how a partner is supporting you in driving a business model that you want to leverage as the telco or as a player in the telecoms industry. And so we've done a quick mapping here for a couple of companies. The first one, Tunstall. So they've been working with Telus and with Telefonica directly as telco providers who are moving beyond just the network connectivity. And what's quite interesting about the Tunstall model is that their commercial partner is different from the player that provides their network connectivity for their solution. And I think that really highlights that different telcos have different ambitions within healthcare, and highlights some happy to play within the network connectivity layer, but others working with Tunstall to actually move further up the value chain and closer to the end user. And Tunstall, a big global company, we've allocated them here to remote monitoring as a primary function, but also playing in virtual care and telehealth and the diagnostics and triage. They're a big global player, and they have kind of a customer base across hospitals and potentially the consumer as well. So enabling the telco to play in a couple of different business models, whether it's B2B, whether it's B2C, or whether it's B2B2X. The next one that we've looked at is Vinsense, who I don't know if anyone saw, but we had a kind of a Q&A article go up on our hub recently with them. And they're quite a small provider, but the first kind of, or claim to be the first medical grade sensor in India. And so really trying to drive remote monitoring in the Indian market and in an emerging market, which we thought was quite interesting. And looking at their value chain, they're primarily targeting the hospital and the B2B segment, but that's both in hospital, but also outside of the hospital in the more remote patient monitoring aspects, not just the in-hospital monitoring of that. And the third one that we looked at was Curacene/Sensara. So Curacene is a company in the US who are focusing on the aging at home and the B2C angle of helping elderly population or the infirm population stay at home instead of moving into retirement homes or nursing homes. They have their own application, but they leverage Sensara's algorithm, who is a company working with KPN in the Netherlands, and who I think target more of the B2B angle and the care home angle. So we've bucketed those together. But what I really wanted to show on this slide was, even though those kind of four companies play in the application space, the end device, they provide the professional services. They have different end customers, and telcos need to define that to think who is the best partner to work with. But they also have different operating models in terms of, what is the role of the telco? And the telco could play in any number of these spaces, whether it's primarily providing their network connectivity, whether it's, moving into the infrastructure where currently public cloud and in-hospital systems are dominating, or whether it is, as I've mentioned before, playing more in this data management space where it is a complex environment, and Tunstall have their own data management platform. Curacene and Sensara have their own. Vinsense, I think, tends to integrate with the existing hospital information systems, but that's an incredibly fragmented ecosystem. And what TELUS have done is brought a level of coordination across that and developed their own solutions there. So each provider probably has their own data management capability, but what the telco can do is then take a role in helping to coordinate that. And yeah, we really think telcos could be doing more to move further up this model, as this is showing just a snapshot of how the value chain breaks down at the moment. So that's kind of what we wanted to talk through in terms of the digital health ecosystem and some of the work we're doing there, and some of the key considerations telcos need to make in terms of not just where in the application space you want to play, but where in the value chain you want to play, and potentially some of the partners you should, or the types of partners you should be looking at to actually make that play. So now we want to come on to the kind of meaty part of the discussion, and actually some of the sizing that we've done in the modeling and the research that's upcoming. So to start with some of the high level findings, in the intro to this webinar and the messaging around it, we mentioned that COVID's had this immediate impact on healthcare, and what we really want to define is, what is the long lasting impact actually look like? We've had this boom in digital health. How much of that impact is going to be long lasting? And so what we've done is modeled the cost profiles here for key metrics in delivering digital health services in the NHS. And this is looking specifically at the UK. The model does look at other countries, but we focused in here on the UK. And what we really wanted to highlight here was not the entire cost base for delivering healthcare services. The NHS spend is upwards of 200 billion. Here we're looking at a fragment of that cost, which we think applies to metrics that would actually be impacted by digital health solutions. And in this graph, the blue line, the dark blue line, is the pre-COVID scenario. So we've tried to forecast and say, if COVID hadn't hit, an adoption of digital health services had maintained a constant trajectory, what would the cost profiles look like across those key metrics? And then we said, okay, well, COVID has hit. How do we think that's changed, in the now, and how do we think that will change adoption in the future? And so I wanted to draw your attention first to the right-hand side of this graph and looking at that pre-COVID line, where what we've seen is this steady decline in those cost metrics. So we are realizing a cost saving based on the adoption of digital health services in the pre-COVID case, and that's in the face of growing and aging population. So if there was no digital health, what we would see is this line increasing. But what we're actually seeing is still thinking there would have been this decrease because of digital health and the impact that it could have. The second thing to really draw your attention to is the acceleration kind of away from that line of this orange line to show that the cost savings in a COVID scenario, a post-COVID scenario, based on these digital health metrics is apparent, and you are getting this acceleration. And a couple of reasons for that are, breaking down of regulatory barriers. In South Korea, we saw the South Korean market actually enable telcos and other providers to offer telehealth services within that market, which was something that hadn't happened before. In the US, insurers actually being able to pay doctors the same amount for virtual consultations as not. So we have seen those regulatory barriers break down. How long will they stay up for, I think, is something to be debated. But what I think will lead to an increased adoption is that now those barriers have broken down and services have been launched, you see tangible proof points for the effect that digital health can have. You see what works and what doesn't work, and that really helps you build the business case. So where before the healthcare industry had to be very slow and timid, is this monitoring device, is this virtual consultation actually going to be effective? What level of savings will there be? What COVID has enabled is a proof point, is a test to show this is the actual benefits that you could see, that you could realize. These are the scenarios where digital health and virtual consultations do work, and these are scenarios where it doesn't, and it enables you to then build from there and really drive adoption of digital health services. And the last thing that I want to point out on this is obviously this stark difference on the left-hand side of this graph, and this immediate cost reduction, again, in these specific metrics, not looking at the NHS as a whole, have been impacted because of digital health, but also because of patient deferral. So we've seen a lot of patients not going to appointments they would have booked because of COVID, and obviously the healthcare system's focusing on treating COVID patients. So what you do see is in these key digital health metrics, like number of consultations, GP hours, starts to decrease in these key metrics because of the impact of COVID pushing patients not to have routine appointments. So this is slightly inflated compared to just the impact of digital health, and a part of what our model will show and does show is what impact digital health specifically has. So trying to remove this bump because of the impact of patient appointments, and really hone in on what is the layer that's digital health. But that's a part in the model, and we obviously don't have time to go into all of it on the webinar today. So that was a look at a quick high level. Before we dive into a bit more of the details, I just wanted to say, what's underneath that? What does the model actually cover? How have we come to those conclusions? And the first thing to look at is that we've looked across 3 scenarios. There's the 0 case, which is saying there's no change in the uptake of digital health. It is as it was in the start of the model. The base case, which is what we showed on the yellow line in the previous, which is saying, okay, well, what was our expected uptake of digital health in a pre-COVID scenario? And then the third, that was the orange line. The pre-COVID was the blue line. So the third, looking at the post-COVID landscape then, and saying, okay, well, what does adoption look like in this post-COVID scenario? And as Amy mentioned, we've looked across our 5 key application areas to think, okay, well, how are these buckets actually changing? And in remote monitoring, we've looked at things like the old and vulnerable population in homes and care homes, those with chronic diseases, whether it's COPD, diabetes, or it's mental illnesses, the actual in-hospital remote monitoring of patients or things, so almost like an asset tracking, inventory management type use case. Within telehealth, of course, virtual consultations in both primary and secondary care, and the ability to book and manage appointments online. Within diagnostics and triage, looking at patient triage, so how effectively can you work out where a patient needs to go in terms of their healthcare system? Is this a GP or a specialist issue? Is this something you need to have an appointment for, or can this be fixed with a self-treatment or one-on-one? And then the diagnostics within the actual patient journey, and within data and analytics, looking at kind of EMRs and universal patient records, but also at a macro level, how can you analyze trends in healthcare to pick out things around drug discovery, drug cycling, patient trends in terms of being very proactive in terms of issues that they could be having. And the last one, which was kind of the personal health and consumer wellness side of things, we haven't modeled yet in the UK based on the global nature of the market. In the others, there's very clear, concise data, and it's very easy to segment. In consumer wellness, because of the global nature of the market, not only is the data less reliable, but it also has less of an opportunity, we feel, for the telecoms industry. I mentioned the fact that healthcare was very regionally and nationally bound was a very strong right to play for the telco. Consumer health and wellness doesn't have that national boundary, in the sense the internet and the global players can have much more of a role there. And so we haven't looked at that as a focus of this model, and we focused on the other four. And at this stage, before we dive into the findings per kind of application area, we just wanted to do a quick audience poll to talk about which application area that we've spoken about do you think will provide the biggest opportunity for you and your organization. So across remote monitoring, virtual care, etc. Where do you think the biggest opportunity is? And so hopefully on your screen, you should be able to see the poll now, and you should be able to click and select some of those results. What we really want to drill into here is not necessarily where you think COVID has had the biggest impact, but what we really want to understand is for you as your organization, if you wanted to play in healthcare, where do you think you would start? Where do you see the biggest value? So we'll give 10, 20 seconds or so to get some results in, and hopefully once we're at a good percentage of respondents, we can close that and share the results. But what we want to then go on to do is to drill into these and think, okay, well, a lot of people are looking at virtual care and telehealth. What is the size of that opportunity? What does it really look like? What has the impact been? And do we think COVID will create a long-lasting impact on it? So give a few more seconds just to get some final answers in, and then hopefully we'll be able to close that poll. So for some reason I can't actually see the poll results.
I'll go through the poll results. Sorry, Darius, when you're presenting, you can't actually see. So some interesting results here, in the sense that 41% of people chose remote monitoring, 31% chose virtual care and telehealth, 22% chose data and analytics, 6% chose consumer health and wellness. No one picked diagnostics and triage. So, I mean, very clearly you can see that people are, really think that for their organizations, remote monitoring and virtual care and telehealth are the big buckets.
Mm-hmm. And I think, yeah, that is interesting. And as we saw from Amy's parts of the presentation, when we looked at the application map, a lot of providers are playing in that remote monitoring and the virtual care and telehealth space. And we've looked at a number of telcos as key case studies in healthcare, and even with them, a number have looked at launching their own virtual care solutions, launching their own remote monitoring solutions. So I think those are very interesting buckets, and hopefully if you can still see my screen on the next slide, what we do is actually break down the cost savings that we saw, so the difference between those two lines in the high level findings by application area. And we've looked at this as a percentage of total spend in the NHS in the UK. And what you can see here is that, again, we have that disproportionate increase at the beginning, so we won't talk about that for too long. What you can see is by 2030, expecting around a 2.5% cost saving based on some of these digital health applications, and just the core ones that we've looked at. But what's quite interesting to pull out is that remote monitoring, a really big application area and clearly a big focus, but has quite a steady growth with no immediate boom versus virtual care and some of the others. And actually, as a percentage of what we think the total savings would look like, not insignificant, but a little bit smaller than virtual care, and actually a little bit smaller than diagnostics and triage. So it's very interesting that no one selected that as a key opportunity area, because we actually think that might be an opportunity area that's creating a lot of value in the digital health space, and actually the most significant portion of our cost savings in the model come from diagnostics and triage. And that's not to say that just because it's the biggest opportunity or it's where the biggest cost savings lie, mean it's the biggest opportunity for you as the telco or you as the telecoms player. But what it does show is that that's where a lot of value might be derived by the healthcare industry, and where potentially there are interesting opportunities to start to pursue some of the initial stages in virtual care and in remote monitoring, but maybe some of the later applications as analytics and AI gets improved to actually move into diagnostics and triage and as Amy mentioned, Babylon Health have done a similar trajectory, and so that could be a really interesting opportunity to look at as a telco for a kind of a long-term strategic roadmap versus, you know, maybe virtual care, which is a slightly shorter term boom. I think the other thing to look at is, which Amy will come on into detail in a moment, so I won't go into it much, but this growth in data and analytics as well. So, you know, that is growing as an opportunity area too, and as you progress through time, becomes even stronger. But I'll hand over to Amy, who can deep dive on some of the actual application areas themselves.
Super, thanks, Darius. So if we start with remote monitoring, which obviously was an area of interest, I think I'll kick off just by going through in detail the different buckets that we have within remote monitoring and how we're defining them. So for looking at the old and vulnerable categories, we looked at both the impact of remote monitoring for those who are at home and might install some kind of assisted living solution, or, you know, might have some kind of wearable or some kind of motion sensor or camera at home. We're looking at remote monitoring solutions that are more than just a safety alarm that you wear around your neck, right? We're looking at something that's a little bit more advanced than just that. That said, it doesn't necessarily always have to be a very fancy sensor. A lot of the sort of remote monitoring that happens is going through, you know, daily questionnaires and daily filling in of your vital signs and things like that. So that's the old and vulnerable category. The next one we have, and they're clearly, as I said, you say here on the slide, they account for the biggest amount of cost savings just because they're the biggest proportion of the population among the three different categories that we have modeled in this area. Then if we look at the chronic disease and mental illness management, I think that probably many of you will be thinking, why have you put mental illness in the same place as chronic disease in terms of your modeling? And I think that's because of the cost analysis, the impact on the delivery of healthcare services. So if you think about somebody who has a chronic disease like, you know, heart disease or COPD, if that's not carefully managed, then they're likely to have a visit to the emergency room and they may need to be admitted. And in mental health cases, there's a similar cost profile, right? If if a mental illness is not carefully managed, then someone may end up in the A&E service. They may then have to be admitted or may need some long-term aftercare for their illness. And so from a cost profile, the way that we measure the impact is similar, and that's why we've gathered them in a similar bucket in this model. The other element is that they're similar, the chronic disease management and the mental illness management, in the sense that what I mentioned before, that a lot of what's happening in chronic disease management right now is very app-based. So, you know, particularly trying to, you know, a lot of chronic diseases are really down to how we manage our lifestyles, how healthy are we? Are we doing exercise? Are we eating well? And that's really about sort of behavioral change and having that support over time. And a lot of that is being delivered through an app function, maybe with a coaching sessions alongside tracking your progress. And that's similar to some of the new stuff that's coming through in mental health, where it's really about making access to mental health services easier, so you can do it through your smartphone, cheaper, so that you can, you know, self-serve a little bit. You might do some self-care, finding out what's wrong, and you may reach out for some more regular coaching that is, you know, or psychology services that are available through the digital apps, which are sort of similar to what's happening in chronic disease management. The final one here, which is quite a small bucket because it's, you know, a relatively narrower field, is looking at the in-hospital monitoring. And there, obviously, there's quite a lot to be saved in terms of the amount of time that nurses and other clinicians and doctors are spending looking for things in hospitals. So it's, you know, it's a small proportion of the overall cost, but you know, there's some data that show that, for instance, you know, an average nurse might spend 2 hours a week trying to find some kind of mobile equipment that they need to support a patient. And that's the kind of thing that we're, sort of the in-hospital asset tracking. And obviously the other thing that's gained a lot of prominence this year is the patient monitoring in hospital for, for instance, especially patients who have COVID, and to protect the staff who are managing them so that they can track their vitals remotely without necessarily needing to be in super close proximity at irregular intervals with patients who have coronavirus. So as mentioned on the slide here, the real cost savings in this area, the biggest buckets are really from a reduction in ambulance incidents and emergency admissions. That's really where you're seeing the biggest throughput and impact on the NHS. Is from having better care through remote monitoring can reduce the need for use of emergency services, and then especially in care homes and in hospital, it's thinking about the more efficient carer to patient ratio, where one carer can be taking care of a number of patients at the same time, and identify high risk patients more quickly. If we move on to the next area, so I've done this in one in a little bit more detail, looking at the telehealth area. And just to note, first of all, obviously the three big buckets that we've got here is virtual consultations in primary care, virtual consultations in secondary care, and online appointment booking. And it's not that there are not other things that we include in this bucket. There are lots of other ones that we looked at when we started building the model. Obviously, online prescriptions is a big one. Just for the UK, the impact is not very big because there's already like 85% implementation rate for online prescriptions. So there's not very much further to go in that space, but that'll be different in other markets as we expand out. Then there's also other things like, for instance, one area that we've looked into is, increased use of augmented reality and virtual reality for educational purposes or for treatment purposes. And we would put this in this bucket, but I think there's not a lot of great data about these because they're quite speculative use cases or very nascent early days. So it's hard to understand exactly what the impact will be, but also the impact is likely to be quite a lot smaller than in these main areas where we're thinking about what is the impact going to be on GP services and on use of existing hospital services. So now to dive into a little bit more detail about this probably potentially surprising curve that you guys have seen in our model. Just a bit of detail. So in England, there was an 11% reduction in total GP appointments in 2020 compared to 2019 due to COVID. And there was a 23% reduction in A&E attendances. So a lot of patients are they're not attending hospitals, they're not going to the GP, they're deferring. And some of it is because it's been deferred because the hospitals are dealing with, an increase in COVID patients. But because those are the metrics that are impacted in our financial analysis, obviously it does create an immediate impact that's not necessarily digital health related. It's from the impact of COVID. And so what we are going to do, and we haven't quite finished this yet, but it will be published in the final model, is to try and break out what is the COVID impact of reduction in hospital admissions and gains that we're seeing from the use of telehealth versus what is the real digital health impact. So that's something that we're going to break out for the final model when we publish it. I think the other thing that I would, just one more point on that slide is when we're thinking about the long-term impact of telehealth, I think that we've modeled this from a cost savings perspective. And in the immediate term, yes, okay, a doctor will move onto a telehealth platform. It's probably already included in one of their electronic medical record services. A lot of them, will tack on a software capability that enables them to do video consultations with their patients. And in the immediate term, that's not necessarily going to deliver a big cost saving for the healthcare system. It may reduce waiting times because it means that patients can go to a GP that's further away from them, particularly in rural areas where there's, low accessibility. But really the cost saving, we think, and happy to be challenged on this if other people disagree. But we think really the cost saving is going to come from not having to have to spend on fixed costs, your bricks and mortar surgery, doctor's office, so that you can deliver remotely. It makes it easier for people to work from anywhere. Maybe a slight reduction in do not attends from the online booking services and being able to manage that online. But maybe over the long term, and this is something that I hope will come through, because I know it takes a lot of time for doctors once you meet with your doctor, that they then have to write everything down, track everything in their EMR. But if you were doing this consultation through a digital system, I think that over the long term, as these mature, there may be opportunity to include things like natural language processing in order to really reduce the time it takes doctors on the administrative side of managing their patients. But those things will all take a long time to come to filter through. Now let's next jump. So in diagnostics and triage, I think the real reason why this is the huge cost area is because anytime a patient is making their way through the healthcare system, one, they're probably not using information services as well as they can, right? So a lot of the time, I'm sure anyone else who lives in the UK, you call your GP surgery and they say, you want to book an appointment with a doctor, but maybe you don't need to see a doctor, or maybe you need to see a pharmacist, or you need to see a clinician, or you need to see someone else. And so a lot of the time we're still going through that process manually. We're going to see the doctor, then we find out we can see someone else, and then we go see someone else, or you have to see the GP 3 times before you find a referral to the right specialist, or you feel like, oh, something's wrong, and you immediately go into the emergency room when really that could have been dealt with at the GP's office. And it's really about getting that information out there. And what you can tell from this graph is, if you're looking at the improved triage, the cost savings that materialize from a reduction in appointments during COVID-19 can probably be replicated with the use of better triage. So just to give you an idea, one of the data points that we found when we were doing our research here, there's a company called DrLink in the UK, which provides solutions for AI-enabled triage and better triage in hospitals. And they estimate that out of the 25 million hospital A&E attendances that occurred in 2019, 4 million of those could have been avoided through better triage. And that cost of those 4 million attendances is about £600 million. So that gives you an idea of kind of how we're coming to these cost savings, and the magnitude of number of appointments that could be avoided in emergency rooms through improved triage. In diagnostics, there's sort of, it's not just sort of in the pre-care section, but it's also afterwards. So for instance, this is more in hospital. If you're having a number of scans, there's a lot of stuff coming through in the radiology departments about ability to use machine learning to assess the scans more quickly and support radiologists in their work to get through more quickly. And there are other things coming out. So for instance, you could get asynchronous care through referrals, where you might be in your GP's office and you need some kind of referral to a dermatologist, and there may be someone who you can get an immediate referral to. You sort of send in a picture and they give a feedback immediately saying, yes, you need to come in and see the specialist, or no, you don't need to. You can just deal with this quickly in XYZ fashion. So there are a few different angles that are coming through to impact on this. And I think just one more point that I will add here that I have in the key triggers is the triggers that we see in terms of adoption of diagnostics and triage services is, one, greater patient familiarity with digital tools. I think that all of us this year have become more familiar with the digital tools that are available so far. So I think that, one of the numbers that I've seen is that there's an NHS app where you can see some of your personal health record. You can see your prescription histories. And not all GPs are linked to it, but a lot of GP practices are. And the number of users doubled to 1.5 million I think, or the number of downloads of the app doubled to 1.5 million just in the first month of COVID kicking off. So that, a lot more people are using these apps. And I think particularly in areas like triage, where hospitals are facing a huge backlog of patients from the ones that they haven't seen during COVID, they're going to be under a really big pressure to figure out how they're going to manage that backlog and how they're going to manage the patients that are going to come through when we get to the other side of this pandemic. So I think there's going to be a big demand here for this type of solution. So last off, I have the data and analytics area. And what I've got here actually is we're showing all 4 categories that we modeled as a percentage of the total. And as Darius pointed out before, right now in the beginning, we're seeing that, the big wins are really impacted by reduction in use of many healthcare services. But when we get kind of back towards normalization in 2023, you can see that, remote monitoring is kind of steady. Virtual care and diagnostics and triage likewise still accounted for fairly, large proportions. But data and analytics is really the one that starts to grow more. And I think that this is a really interesting opportunity, but it's one that's going to take a little bit longer to materialize. So if you look at elsewhere in the adoption of AI and advanced analytics in other industries, the things that have been the key triggers for advances in AI have been the creation of loads of data through internet platforms and applications and all of that, the reduced cost of compute power, and improving algorithms. Now, if we look at the healthcare sector, it has the same access to the same computing costs. And although algorithms obviously need to be developed in a bespoke nature for different use cases, and there'll be some work to do on that in healthcare, the real barrier has been the access to data. And of course, there are so many challenges around this. How do you share healthcare data safely and securely and privately and put it in control of patients' hands? But also, what I believe is really missing in this market is access to universal patient records. So not everyone is duplicating them everywhere, and that's really what will allow countries to have a higher level visibility of what is actually going on in their healthcare markets. And just to give you an example of the level of duplication, so in England, there are 54 million patient electronic medical records, and there are an additional 23 million episodic electronic healthcare records in hospitals. So the EMRs are in GP offices mainly, or other care organizations. The 23 million are in hospitals, and that's out of a population of 56 million. So, there's 1.5 records per person out there, and probably, for the people who go to lots of different hospitals and get admitted to A&E, they have to give their details every single time. And if that could be avoided, it could save a lot of time on the care delivery side, but it would then also give much better visibility into what's going on. And once that data becomes available, I think the reason why we see the data and analytics stream growing a little bit more quickly towards the end is then it starts a snowball going. Once the data is there, a lot can be done relatively quickly. So that's a whirlwind tour through some of our financial analysis of the impact of COVID on the digital health market in the UK. I think just want to give you guys a little bit of a heads up of what's coming from us over the next little while. So what's happening with this research? So obviously today we've presented some of our findings from our analysis of the UK market. We are building up bottom-up analyses that are similar to this for the USA, Canada, China, and a couple of other countries. So what we've tried to do there is to get, obviously the UK is a publicly funded healthcare market. The USA is going to look very different as a much more privately funded healthcare market. The Canadian market will look different again as a highly fragmented market and somewhere in between in terms of public versus private or employee insurance spending in healthcare. And then China will give a view of an emerging market. And obviously we know that there are a lot of differences between the developed markets and the emerging markets, and there are a lot of differences between China and other emerging markets. And we are really aware of that, and that's something that we're going to be thinking in very carefully when we're incorporating our assumptions to building out a global database tool based on those. So, you know, the things that we'll be thinking about when we extrapolate globally are things like, you know, what is the payment structure? Which market is it most similar to? What is the level of healthcare capacity and access in a given market already? What's the level of technology maturity already in a healthcare market? Obviously, a lot of the things that we're talking about today depend on having electronic medical record systems in place, and that may not be the case in a lot of countries already. Things like penetration of smartphones. A lot of this depends on us having smartphones in our hands. So those are the things that we'll be thinking about when we build out a global database tool. The next thing that we'll be doing is we'll be breaking down the value for telcos. So now that we understand which application areas are most valuable and having the biggest impact from COVID and across the digital health market at large, we're then going to break down across the vertical chain that Darius was looking into to try and understand more clearly which ones deliver the best value for telecoms operators. And from there, we'll be in a position to build out bespoke country and application level analysis. The last thing is that we're going to build out the digital health ecosystem market mapping that we showed at the beginning. And that's really to try and help telcos identify what kind of partners they could work with, what partnerships are already on the market, and what's the structure of those partnerships and how do they work. So I realize we've talked at you for a little while now, but hopefully have left time for a few of the questions that have come through.
Thanks, Amy. Thanks, Darius. That was really interesting. So yeah, as she said, we're now going to move on to the Q&A, and we've got a few questions already, but do please keep submitting questions. Really interested to hear what your thoughts are and what you're interested in discussing with us today. And if we don't have time to reach any of your questions, then we'll still be sharing a written response after the webinar. So go ahead and ask away. I think we'll kick things off with a question from Jake that I'll ask you, Darius, because I know you've done a lot of research in this area. Jake was wondering what we thought, looking at the applications area of the value chain, which applications we feel are only possible with 5G, and you know, which really rely on that high bandwidth, low latency that 5G can provide.
Yeah, it's a good question, and I think one that that a lot of the industry is looking at. And actually, around about this time last year, we put out a paper looking at the impact of 5G on healthcare industry, and the process that we went through was first identifying what are the use cases that are most 5G and will be heavily impacted by 5G. And we did, you know, an interview program with solutions providers in the healthcare space to understand the role of 5G with them. We interviewed other telcos to understand, you know, where do you think 5G is going to go, and what application areas are you looking at? And then more recently built on that in a research program looking at kind of more private 5G and mobility in that way. And trying to understand again what are the use cases there. And before I go into any of the actual applications, I think it's important to say that, you know, a lot of these can be delivered over 4G. It's not necessarily that, you know, virtual consultations, for example, needs 5G. But what 5G really provides is the catalyst for transformation, and that was that point came up across all of the interviews, and it was saying, you know, regardless of the tech specs, what 5G brings is innovation, and it brings a partner ecosystem and a developer ecosystem to actually drive some change in these areas. So that's the first thing. And the second thing was, you know, how ubiquitous is 5G coverage going to be in the short term versus, you know, wide area mature 4G. And so what we really looked at was comparing mature 5G to mature 4G and trying to think, you know, what are the incremental gains there. And you know, yes, 4G does have a lot more coverage, and you could deliver services on 4G, but you know, in a lab, it might be getting really good speeds, but in that wide area, there's a lot of variation in terms of latency, jitter, etc. And so what 5G brings is a better consistency of experience, and I think that's quite important, because a lot of these are consumer-facing applications, and they have a lot of choice. So if you can provide a consistency of experience, then you're likely to drive adoption. So that was the other part. It's not necessarily that they require, you know, the lowest latency and the highest bandwidth compared to some other application areas, but what they do provide is that 5G provides in healthcare is a consistency of service. In terms of the actual specifics that we looked at, you know, HD virtual consultations is a really interesting one because it does have a high bandwidth and low latency requirement, especially if you're moving beyond just, you know, I can have a regular call with my doctor to, you know, I can have a call anywhere outside with my doctor, but also if it needs to be a diagnostic type call where, you know, they need to look at specific skin tags or melanomas, you can actually start to do that virtually, whereas, you know, over 4G, the quality of communication might not be good enough to actually provide that. And so the idea is 5G could provide some level of benefit there. One where we have seen, you know, trials on 4G versus 5G to say, you know, is 5G actually that important, is connected ambulance. And BT actually in the UK have done some trials here, and you know, they've tried it on different connectivity solutions, and actually the only one that had a sufficient experience was 5G. So connected ambulance, quite an interested one in the virtual care and telehealth space for 5G. But then, you know, some of the other ones that we've looked at are the remote monitoring side of things because of the security of the network and the speed there. I think in terms of the private network, one that we'd looked at was more kind of virtual desktop infrastructure and being able to very safely and securely connect, you know, someone who may not be at a specific workstation in a hospital to be able to access that dashboard in a very secure and low latency way can be quite an interesting use case as well. So those are a few that we've looked at. Amy, I don't know if you had anything that you wanted to add on that.
Sorry, I was looking through the questions. No, that's fine, Darius. I think that you've pretty much covered that one.
Nice. Okay, in that case, I have a question for both of you from Andres, who wanted to know if we're seeing the tier 1 telcos taking the lead on this, and if not, what do we think are the main obstacles to telcos in making this happen?
I think that we're seeing a range of different telcos look into the healthcare opportunity. I think our experience has been that there is a lot of interest, but not a lot of real significant long-term commitment. I think there is a lot of early stage commitment or trying to figure out the strategy. And I think that the real barrier for telecoms operators is figuring out exactly which bit to focus on and what the strategy in the market is. And we've tried to cover that in some of our previous webinars, and it's, you know, something that we're always looking at going forward. So I think that it's not necessarily like a tier 1 operator versus a tier 2 operator opportunity. I think it's a level of commitment and then finding your area of strength, right? So I saw that another one of the questions was asking, yeah, okay, telehealth is a really big opportunity, but how do telcos actually monetize this? And I would say, yeah, you know, if you were a telecoms operator in the UK, it's quite hard to monetize telehealth because that market is a little bit tied up, and it's not necessarily playing to your strengths. Whereas if you are in an emerging market where there's a real challenge of access, where, you know, people may want to see the doctor, but it's really expensive or it's far away, and they're willing to pay out of pocket for that, then telecoms operators can leverage their distribution networks, they can leverage their brands, they can leverage their commercial presence in order to bring something like a telehealth service to market. It's much more viable. Or if you're like TELUS in Canada and you've built up an entire business around healthcare, then you can leverage both your distribution networks to deliver the service, as well as your relationship with the government in order to figure out the funding and the payment on the back end. So it's quite a difficult win for telcos that are in developed markets and, you know, trying to get in there today. So if you're a telco in a developed market today, then it may make more sense to look at a slightly more nascent area like remote monitoring, and, you know, focus in on a specific niche of remote monitoring where you feel that you have some good relationships that you can build on top of, or that you know there is buy-in from your executive level to make an investment in developing those capabilities.
Yeah, okay. Well, great. Thanks for that. That was super helpful. And it looks like we're out of time, so unfortunately won't be able to go through any more questions now. But really appreciate your presentations, guys, and thank you as well to the audience for tuning in today and participating in the question and answers and asking some great questions. And as I said, we'll follow up with the slides and recording, and we'll also be sharing written responses to all of the questions that we didn't have time to discuss today. And if you have any other questions or are interested in discussing any of the topics that we covered today, then we're always happy to hear from you. So more than happy to answer any other questions or jump on a call. So do please reach out. And yeah, I guess all that's left to say is thanks again. And thank you for joining. Hope you have a great Christmas.
Thanks everyone for joining us. Bye.